Hello everyone. I am Dr. Berkkkaratas. In erectile dysfunction, we continue with prosthesis treatment for the penis. Protest treatment, I mentioned before, is the last resort in patients who do not get results from the first and second steps. Let me remind you briefly. We recommend applying shockwave, medication, PRP, vacuum therapy in the first step, needle therapy in the second step, and even prosthesis treatment in patients who do not benefit from stem cell treatments, which will soon be among them. It's technically a non-reversible method. I've explained this before. All treatments are done to improve this area or improve this area. But in prosthetic treatment, we destroy this area and place artificial cylindrical rods here. That's why I have had this treatment. I don't like it anymore. If we say I will take it back, we will not have an erection again. Is it obvious from the outside? This is the most concerning situation. These prostheses are not like hand and foot prostheses. When viewed from the outside, it is not clear whether the person has a prosthesis or not. People continue to enjoy it. We apply it here. We do not damage the nerves here, the skin or any other place in this area. Therefore, the person continues to feel pleasure, the ejaculation function continues, it does not cause any difficulties in urinating. As you know, our ejaculation is also through the urinary tract. This is where we urinate, therefore, we have nothing to do with this place. We place the prosthesis in this area. Is there a shortening or lengthening of the penis length? This is also controversial. In newly released prostheses, a few centimeters of lengthening and thickening of the penis can occur. But basically, whatever your penis size is, it happens after the prosthesis. In some diseases, especially if you have calcifications in this penile area such as Penile, then there may be a shortening of penis size by 1 centimeter or less. Is there a risk of infection? Yes, there is. Especially in newly released prostheses and 3-piece prostheses, this risk is much less because they are covered with antibiotics, but there is still 1% infection. We are trying to treat it with antibiotics. If we succeed, we succeed. If not, we remove the prosthesis. Then another prosthesis can be placed in another session. It has a 95% success rate. Spousal satisfaction is 96%. The duration of the operation is about 1 to 2 hours. Duration of hospital stay, I usually host our patients in the hospital for 2 days. After an average of 30 days, we cannot use the prosthesis immediately. We use it after an average of 30 to 40 days. We have a training process, especially in 3-piece prostheses. After this is completed, the prosthesis can be used. We can classify prostheses in 3 ways. 1-piece, 2-piece, 3-piece. 1-piece dentures are also called bendable dentures. It is the simplest. It is the easiest to use, and it is the cheapest. But besides that, it has a few handicaps. Normally, your penis always looks hard. When this prosthesis is inserted, when we do not use it only with your hands, we can provide a bend of 7 to 10 degrees, a little down. Therefore, especially when wearing a swimsuit or wearing tight pants, this prosthesis appears hard from the outside, that is, your penis from the outside. Unfortunately, such a 90-degree curve does not happen, as seen in this animation. Less curl is provided. That's his biggest handicap. From the outside, your penis looks like it's always hard. Since the 2-piece prostheses and 3-piece ones came out, we don't use them much anymore. Since the prices are very close to each other, patients do not prefer it. Frankly, I don't prefer it much either. The basic principle here is that we have a pump where the eggs, that is, the testicle, are. This pump has water in it. When you press it, the water is transferred to the penis. It is transferred to the penis. That's the principle. When we are done, we put pressure on the penis and transfer the water back into the pump. That's the basic principle. 3-piece dentures are currently the most common prostheses we recommend to patients. It is the latest technology, they are the prostheses with the least infection. Compared to others, it takes a little longer to apply, that is, to be applied surgically. There is an application time of about 2 hours, but these are the most effective prostheses. Here we basically place a pump in their eggs there, as in the case of a 2-piece. But the difference is that there is not a lot of water in this pump. In this way, it takes this water from the structure we call the reservoir that we place in the abdomen and transfers the water to the penis. When we're done, we don't press there, we don't press the penis, like we do with the two-piece. There's a little spot over there. When we press this point, it transfers the water from the penis to the reservoir. The biggest advantage of this prosthesis is that when viewed from the outside, our penis looks exactly like it does when the person is not normally hard. In fact, I describe the patients as follows. Leave home, return home after 2 months, use this prosthesis. Your partner will not understand that you have dentures. From the outside, the penis does not look hard and is not visible. Since an expensive prosthesis is, of course, the latest technology, the company gives a lifetime warranty. Especially in this cable area, if there is a problem with the reservoir and pump, the company can replace it free of charge. If it happens due to accident or any other reason, then each part of them can be replaced individually free of charge. In our next video, we will continue with herbal treatment for erectile dysfunction. Thank you.